You know that feeling, right? You wake up with a stiff, painful neck and you think, ugh, I must have slept on it wrong. Well, what if it's actually more than that? Today, we're diving into torticollis, a condition where what looks like a simple twisted neck can be a sign of something much, much bigger going on.
All right, so where do we even begin with this? Well, let's start with the name itself, because, in medicine, a lot of the time the name tells you pretty much the whole story right from the get-go.
And this one is super direct. It comes from two Latin words, tortus, which means twisted, and collum, which means neck. So, literally, twisted neck. It's basically the catch-all term for a bunch of disorders where your neck muscles just decide to contract, all on their own. It's like they have a mind of their own, causing your head to tilt, or turn, or even get stuck in a really awkward position. So this really is the million-dollar question, isn't it? Is it just a simple muscle strain from sleeping funny, or is it something else? Because here's the thing, that exact same symptom, a twisted neck, can be a huge red flag for some pretty serious conditions. And figuring out which one it is, well, that's absolutely crucial.
Okay, so the very first step to really get a handle on torticollis is to think of it as a fork in the road. There are two main paths here, cases that you're born with and cases that pop up later in life.
And here you can really see that split. In one camp, we've got congenital torticollis. This is something a baby is born with. It's not super common, affecting less than 2% of infants. It's often because of how the baby was positioned in the womb, or maybe some trauma during birth that caused a little bit of scarring in one of the big neck muscles. Then, in the other camp, you have acquired torticollis. This is the one that can happen to anyone, at any age, and boy, the list of potential causes is long. So let's really zoom in on that acquired type, because this is where what seems like a straightforward symptom turns into a real medical detective story.
Now, a lot of the time, the cause is exactly what you'd think it is. You slept in a weird position, you pulled something, maybe you're getting over a virus, or it's even a side effect from a medication. The good news is, these are usually temporary. They tend to sort themselves out on their own after a few days or weeks.
And this is a huge but. This is exactly why doctors get so concerned. That same twisted neck could be the first and only sign of something way more serious. We're talking about things like a deep infection in the neck. Think of it like a dangerous pocket of pus, or a fracture in your spine, or even, in some cases, a brain tumor. These are true medical emergencies, and that twisted neck is the alarm bell. So, okay, let's say it's not a simple strain. It's not an injury, and it's not one of those scary infections. What in the world could be causing this persistent, involuntary twisting? Well, this is where the story takes a really interesting turn, away from the muscles and straight to the brain.
Turns out, for a lot of adults dealing with chronic torticollis, the problem isn't actually in their neck. Nope, the root cause is a neurological movement disorder called dystonia. And when it affects the neck like this, it's often called cervical dystonia.
So what is dystonia? Think of it like a communication breakdown. It's a signaling problem in the brain. Instead of sending smooth, coordinated instructions to your muscles, the brain sends out these faulty, jumbled signals. The result? Involuntary muscle contractions that are often repetitive and patterned, causing the twisting and strange postures we see with torticollis. And because dystonia is so complex, experts needed a way to organize it all. So they came up with this really smart two-part system. Axis I is basically the what. What does it look like? Which body parts are affected? When did it start? Axis 2 is the why. Is it genetic? Was it caused by an injury or medication? Breaking it down like this is absolutely key to getting the diagnosis right and finding the best way to help.
Right, so once you figure out the root cause, is it a muscle thing, an infection, or a brain signal thing, then you can figure out how to treat it. And getting that cause right is everything, because it totally changes the game plan. You can't fix the problem if you don't know what you're fighting.
And that game plan is usually a multi-pronged attack. There isn't a single magic bullet, especially for the dystonic kind. So it's all about managing the symptoms and making life better. Think of it like a toolbox. You've got physiotherapy, which is really the foundation of treatment. You've got medications, like muscle relaxants. Then a really important tool for dystonia is botulinum toxin, Botox, which gets injected right into those overactive muscles to tell them to just calm down. And for some very specific, really tough cases, surgery might be on the table.
This quote really nails why physiotherapy is so important. It's not just about stretching. It's more like retraining your muscles. Imagine a tug of war. The dystonic muscles are pulling way too hard in one direction. The goal of PT is to get those muscles to relax, and at the same time, strengthen the muscles on the other side, the antagonists, so they can pull back effectively.
It's all about restoring that balance to bring the head back to a neutral, comfortable position.
So, yeah, the next time you or someone you know complains about a stiff neck, you'll have this whole other perspective. You'll know it's not always just a simple strain. It can be this incredible, complex crossroads where muscles, infections, and even the brain's wiring all meet. It's such a powerful reminder to really listen to the signals our bodies are sending us, and it definitely makes you think. What other simple symptoms are out there, just waiting to tell us a much, much deeper story?